Dear all, in this video, I shall be discussing about Reinke's edema. This is defined as accumulation of fluid in Reinke's space, which lies below the epithelium of true vocal cords. You can see here this is the squamous epithelium, and this is the respiratory epithelium starting in the superficial lamina propria. So this space is called as Reinke's space. Although called as a space, this is not a true space, and there are other structures lying within it. There are certain synonyms of Reinke's edema, although many of them are misnomer. They are bilateral diffuse polyposis. The polyp occurs bilaterally, so this is called as bilateral diffuse polyposis. Diffuse. Smoker's polyp. It is more common on chronic smokers. Polypoid chorditis. Polypoid inflammation of the vocal cords. The vocal cords become like a bag of fluid. Polypoid degeneration of vocal cords, which is a misnomer, and localized hypertrophic laryngitis. Reinke's edema accounts for around 10% of benign laryngeal lesions, so this is not an uncommon condition. You can see here, this is the Reinke's space. The etiology of Reinke's edema is multifactorial. Common irritants like tobacco smoke, dry air, dust, and alcohol may lead to Reinke's edema. It is most commonly found in people who smoke cigarettes. So this is also called as smoker's polyps. Persistent laryngeal allergy, chronic sinusitis, hypothyroidism, and sometimes the cause may not be found out. The edema is limited to superior surface of the vocal cords. This is very important because there will be dense fibrous attachment to conus elasticus on undersurface of the vocal cords. So when the patient presents with Reinke's edema, there will be superficial or swelling in the upper part of the larynx. Coming to clinical features, this condition is common in men between 30 to 60 years. There will be monotonous, low-pitch hoarseness, and there may be diplophonia due to asymmetric vocal cord involvement, because these bags, this is symmetrical here, but the vocal cords may be asymmetrically swollen. That leads to more of the mass lesion on the vocal cord, and that decreases the mobility of vocal cord, leading to diplophonia. Although more common in men, when it presents in females, it is more commonly detected because the females usually have high-pitched voice, and it leads to low-pitched monotonous voice, and the voice becomes harsh in females. When there is gross edema of the vocal cords, that may lead to stridor. Early cases, there may be increased convexity of the medial vocal cord margin, and in late cases, there may be pale, watery bags of fluid on superior surface of the vocal cords, as already told, which move to and fro on phonation. There will be fusiform swelling of the vocal cords. This is the fusiform swelling. You can see here. We can see a bag of fluid appearance. How to treat this condition? The most important treatment is elimination of causative factors. Smoking is the most common causative factor, so patients should stop smoking in early phases, and the allergens are to be avoided. Vocal cord stripping is one of the solutions for Reinke's edema. It is performed under microlaryngeal surgery, and the vocal cord is stripped out. The fluid can be taken out. We make an posterior-anterior incision on the superior vocal cord surface. As we have already told, the fluid lies basically in the superior part of the vocal cords. And the edematous fluid is sucked out, and tissue is removed with cup forceps. Redraping is performed. The tissue is redraped. Voice therapy is important, and we perform voice therapy 1 week before and 3 weeks after the surgery. So patients shall be alright once the patient stops smoking and opts for voice therapy. You can see the surgery being done here. This is a vocal cord stripping. The incision is made here. You can see the incision on both the vocal cords, and the fluid is identified. And edematous tissue and fluids are being removed here with cup forceps. You can see cup forceps and suction being performed here. Vocal cord is trimmed and redraping is performed. This is the redraping procedure, and this is the trimming of the vocal fold. This is a pre-operative finding of the Reinke edema. You can see it's a huge tissue filled with fluid here, and this is post-operative. The airway is well maintained. Thank you very much. Please subscribe my channel Dr. KrishnaKoirala for further videos like this. Thank you.